Hello all, this is Dr. Alsop, and now that we have a pretty good idea of what the different vertebrae look like in the vertebral column, let's add some ligaments, and we'll talk about one type of joint as well that you will see in the vertebral column. And I'm only talking about the ones that will be more visible in a laboratory setting. Okay, so we're going to start with the posterior longitudinal ligament, and right here, we're looking at a really close-up view of the body of the vertebra. And then this is, of course, going to be the spinal cord right here. So this means that this is going to be more posterior over here, and this would be more anterior here. Remember, the body is going to be anterior just in general in comparison to the rest of the vertebra. And then that vertebral arch would kind of extend over this region if it hadn't been cut in order to be able to see this. So the posterior longitudinal ligament is going to kind of follow along the posterior portion of the body. And the anterior longitudinal ligament, which isn't on the list, but you can kind of get an idea of where that would be located on the more anterior side of the body. So the PLL is going to be that most anterior feature of the vertebral canal, this region here. Over on this particular side right here, we're looking at, so you can see a bit of the spinal cord right here. This is going to be that dura mater, and the dura mater is reflected up in order for us to be able to see that posterior longitudinal ligament right here. And so the bodies would be right there. We've done a laminectomy in this particular dissection, so that vertebral arch has been removed. So you could see the spinal cord, and in this particular image, you'd have to move that spinal cord and the meninges out of the way in order to get to the posterior longitudinal ligament when coming from a posterior approach. The ligamentum flava, or flavum if we're talking singular, is going to be located or spanning the distance between adjacent laminae. Okay, so multiple lamina within that vertebral canal. So what is happening here, and you can see a little bit in terms of the pedicle regions, we're looking at the more internal portions of the laminae, and you can see a little bit of this kind of yellowish right in this region here. And so, depending on the region, sometimes you have quite a bit. It's kind of like what you have here. Sometimes you only have a little bit, like you have right there. It typically will become more robust. The ligamentum flava will become more robust in the more inferior portions of the vertebral column. But when you're doing a laminectomy, if you look at the inside of the laminae, which is what we're looking at in this particular view. So we're looking not on the superficial surface, that would be more posterior, we're looking on the inside of where it would be associated with that vertebral canal, then that's where you can see the ligamentum flava. Last but not least are the intervertebral discs. And when you're looking at an actual dissection, they are a little bit difficult to see. You can see a little bit of one right here. It's going to be deep too as well, because that posterior longitudinal ligament not only is covering the bodies, but it will cover the intervertebral discs as well. In fact, the PLL, or that posterior longitudinal ligament, will fuse with the annulus fibrosus of the intervertebral discs. So it's often difficult to see in a dissection without doing a careful removal of the PLL. But you could do that in a few areas and kind of pick that up. And this is looking at a more of a model. So you have a body here. We're looking at a lumbar region. And this region right here would be the intervertebral disc. And so if you're looking at an intervertebral disc that has not been opened up, you're only seeing the annulus fibrosus, or that outer portion of the intervertebral disc that is surrounding the more internal nucleus pulposus. So you would not be able to see that right here. And just for fun, since we're here, you can see a nice view of the intervertebral foramen here between that inferior notch here and superior notch. All right, excellent. So those are the things that you're going to be able to see in a dissection. That's why these are on your list of structures. We talked about quite a few more ligaments when we're going through the learning objectives, so understanding conceptually where they are located are going to be important for some other ligaments, but we'll only pick the ones that I think are going to be feasible to see in a dissection. All right, excellent. Thank you for your time and attention here, and I hope that you have a great rest of your day.